Part of Lisa Looney's job is making the rounds, checking on patients recovering from joint replacement surgery at Lee Memorial Hospital.
Yes, so I try to make rounds on every patient that comes in, and then try to individualize a plan of care for them at that time.
Theodore Ladieu is one day out from a hip replacement. He's had joint work done before up north, but didn't have access to someone like Lisa.
And most hospitals don't think of that and set up an orderly process where they can anticipate what the patients are going to need. So having a navigator is really kind of unique in my experience.
Based on the success of cancer navigators, which guide patients through their cancer care, orthopedic navigators are now showing up in more healthcare settings, hoping to replicate outcomes with ortho patients.
We want the patient to be very well educated on the process. So we find that if patients know more about what's going to happen and there's no surprises, they do much better.
The navigator is an extra layer of care following people on their joint journey, making sure they have everything they need before they get to the hospital.
We would like to have contact with the patient very early on and after they've made a decision to have surgery so that I can help them go down that path before surgery.
They were in pretty much constant contact with me.
Ansel leaned on the Navigator program during her hip replacement 5 months ago.
They would call me and ask me how I was doing and give me the steps that I needed to take, like some blood work that I had to be done before surgery.
The added support streamlined the process, giving Ann the security she needed.
My surgery was so successful, I went hiking out in Utah. I'm doing things that I haven't been able to do in a couple of years, which is just a blessing.
The orthopedic navigator giving patients a leg up on their joint replacement. For Lee Memorial Health System, I'm Amy OSHIER.